Thank you very much, Vince, for your kind introduction. It's truly a pleasure to be here among so many old friends, colleagues, and esteemed leaders from across Indiana's thriving life science community. Lilly has called Central Indiana home for nearly 150 years, and diabetes is where we got our start, with the discovery of insulin back in 1922. I've had the privilege to work for Lilly for 34 years, and every day when I arrive at our headquarters, I pass a large statue, the caregiver, and many of you might have seen it when you enter into the Lilly campus. This statue depicts the first boy that Lilly treated with insulin together with his mother. And it stands as a testament to Lilly's commitment to understanding the patient journey and the emotional and physical challenges that families face in managing diabetes. For me and many of my Lilly colleagues, the statue energizes us as it is an inspiring reminder that we must continue to make life better for patients, caregivers, and their loved ones living with complex and chronic diseases. Today, Lilly's breakthrough medicine, tirzepatide, marketed as Zepbound and Mounjaro, approved for treatments for obesity and diabetes that have unlocked the new treatment option for millions of impacted by these chronic diseases. Zepbound and Mounjaro are positively changing the lives of millions, and one of the many to thank for their development is Professor Richard Markey, Distinguished Professor of Chemistry and Gill Chair at Indiana University. You will hear from Richard later today, but I would like to thank him for the impact his research and work has had at Lilly, including the discovery and development of rDNA-derived treatments. Personally, I know the impact of Richard's work. My mother's life was changed by Forteo, a medicine that Richard was instrumental in bringing to the market. So please join me in thanking Richard. I'm also excited that you will hear this afternoon from my colleague and friend, Dr. Ruth Gimeno, who leads the cardiometabolic research and early clinical development at Lilly. And I also want to recognize Senator Todd Young and all policymakers joining us, and we're really grateful for their service. But I would be remiss if I also didn't recognize great advocacy organizations like the Obesity Action Coalition, led by CEO Joe Nadglowski. Together, last month, we launched a bias-free obesity image gallery, providing a 3D collection of authentic, diverse, and humanizing images of people with obesity that truly aim to change how this disease is being viewed. So thank you very much, Joe, and the Obesity Action Coalition for your leadership in fighting bias and stigma while also advancing care and access for people. With partners like the OAC, we at Lilly continue to work hard to address one of the seemingly intractable healthcare challenges of our time: obesity, a complex chronic disease that currently impacts more than 1 billion people worldwide. And while most of you are likely familiar with obesity and the impact, I wanted to open today by sharing the staggering impact this disease has on patients around the world. Between 1990 and 2022, adult obesity has more than doubled, and adolescent obesity has quadrupled. More than half of the global population is projected to live with obesity and overweight by 2035. And low-income and minority populations are also disproportionately affected by obesity. And these populations face often insurmountable political, economic, and social barriers to health. This is especially true nationally for Black African American women, who have the highest obesity prevalence of over 55%. And this is true also here in our home state of Indiana at 52%. Obesity has major health implications as the 5th leading risk for global deaths, with nearly 3 million adults die each year as a result. Obesity also puts people at an increased risk for more than 200 health complications, ranging from heart disease to diabetes, and exacerbating mental health conditions as well as cancer. And despite being declared a disease by the American Medical Association more than a decade ago, obesity is still seen by many as a lifestyle choice and not the chronic, complex disease it is. And many people with obesity often face intense weight stigma from those around them, oftentimes preventing them to get access to the care they so badly need. And while the collective impact of obesity is staggering, it's the positive personal impact on people's lives that really makes the work we do at Lilly so meaningful. Let me share with you a patient story. Noel. Noel is a Zepbound patient who tried numerous diets and exercise attempts time after time, but struggled to manage her weight health, and the day-to-day activities also were taking a toll. After taking Zepbound, she was able to live the life she was hoping for, full of dancing during Samba classes and able to show up fully for her son and family. The results that Noel experienced from taking Zepbound made her finally feel seen. Stories like Noel's motivate us at Lilly to lead a new area of transformation for the health and well-being of people around the world, and to deliver breakthrough outcomes across the spectrum of several disease areas. I refer to tirzepatide, marketed as Mounjaro, was first FDA approved back in 2022, and it was the first and only approved dual agonist treatment for the type 2 diabetes. And it works differently than other type 2 medications by really activating both the GIP and the GLP-1 pathways to help regulate blood sugar. And we continue to build upon our strong foundation in diabetes as we broaden our focus to the overall space of cardiometabolic health, inventing medications that disrupt disease progression in not only type 2 diabetes, but also for obesity and for cardiovascular diseases. And there is a lot going on in research and development. And we have several exciting and promising trials in phase 3. Let me share with you a couple of those. The first one is orforglipron. It's a once-daily oral non-peptide GLP-1 receptor agonist. And it achieved almost 15% mean weight loss reduction at 36 weeks of treatment in adults. If this is proven also in phase 3, it would be the first time we have an oral treatment with injectable-like efficacy. Another one is retatrutide, an injectable medicine where we're adding the pharmacology of glucagon to GLP-1 and GIP. And this continues to demonstrate compelling results in clinical trials. In the phase 2 trial of retatrutide, patients treated with the highest dose achieved a mean weight reduction of more than 24%. And this translates to an average absolute weight reduction of about 58 pounds over 11 months of the study. And while we're excited about our pipeline, we also remain truly focused on patient safety, including combating counterfeit and mass-compounded medications. And in the works is new technology that truly allows patients to verify that their Lilly medication is genuine. And we will continue all those efforts in rolling out in 2025. And patient safety is of utmost importance in today's world, particularly when we see a lot of fake and mass-compounded medicines in the marketplace. And we have a strong commitment to expanding access to all people with cardiometabolic health diseases. We know that obesity has a profound impact on the state of Indiana, our places of work, and the economy overall. Any discussions, though, on economics and obesity should first start with recognizing the impact that obesity has on an individual's health, an individual's well-being, an individual's social engagement. And it's critical that we think about these effects to individuals and society and how we do our part as business leaders to address this epidemic and support our future workforce. And we supported an economic study that was showing that women with obesity are disproportionately impacted, suffering a 20% lower employment probability and 9% lesser income when compared to women with healthier weight. In Indiana, we found that obesity and its negative health impact causes over 65,000 people to not participate in the labor force. And we see how this disease, untreated, can impact individuals' lives and our collective community. And we will continue all our efforts to continue to help educate employers and policymakers on the disease of obesity and the value of treatment. And we know that companies who prioritize the health and well-being of their employees, including providing coverage for obesity treatments, they are seen as highly desirable places to work. And a recent survey demonstrated that in the US, 44% of people living with obesity would change job just for this kind of health benefit. For Medicaid enrollees, the lack of access to comprehensive obesity care limits their clinicians' ability to provide patient-specific obesity care at parity with that of other chronic diseases. And this fact perpetuates the health and economic impact of obesity on individuals and the state of Indiana. So if you are in a position to advocate for broader coverage of these treatments, being in the public or the private sector, please join Lilly, join the OAC in advocating for equitable care and coverage for people living with obesity. You might have heard about the huge demand for these medicines. So what are we doing to address the demand for tirzepatide? Well, to meet the needs of various patient health populations and the demand for our medicines, we've also worked on deploying innovative and multifaceted approaches to manage this. Since 2020, we have invested more than $20 billion to build, upgrade, and acquire facilities around the world. And here in Indiana in October, Lilly announced another $4.5 billion investment in our facility in Boone County. And this brings our total investments in the area to more than $13 billion. And these state-of-the-art facilities will bring more than 1,500 high-paying jobs. And it in addition to that, also bring more than 5,000 construction jobs while expanding Lilly's production capabilities to also address the need for medicines treating diabetes and obesity. But we also remain committed to our great state of Indiana in many other ways. And Lilly helped establish Indiana as a hub for pharmaceutical research and innovation, fueling advancements and spending more than $9 billion in R&D, which supports the collaboration with Indiana's universities, startups, and other local research institutions. The Lilly Endowment, which is a separate foundation, but value is based upon Lilly's stock price, has assets approaching $75 billion and has provided millions in grants for local healthcare and scientific research, improving health outcomes and enhancing Hoosiers' quality of life, as well as lives beyond the borders of Indiana. So in summary, Indiana is at the heart of the fight against obesity. And Lilly's breakthrough treatment and pipeline are strong, but we must do better for those that can benefit the most from these treatments, helping to advocate for better coverage and fight against the stigma surrounding diseases like obesity. If we do that well, we can do much more impact on people like Noel. Thank you very much for your attention.